Kenya Union of Clinical Officers has hit out at the Social Health Authority for locking out facilities accredited by the Clinical Officers Council from offering healthcare services under the new scheme. The union accuses the Ministry of Health of sidelining them in the rollout. Clinical officers claim that they provide 70% of all clinical services in Kenya. And as Mary Morki reports, the union has threatened to have members hold demonstrations in 2 weeks if the government fails to empanel and publish all healthcare facilities registered by the Clinical Officers Council as required by law.
Confusion and infighting continue to rock the newly rolled out Social Health Authority that became operational on Tuesday this week, with clinical officers joining the list of those aggrieved by the manner in which the rollout is being implemented. The Kenya Union of Clinical Officers is accusing the Ministry of Health of removing facilities registered by the Clinical Officers Council from the panel of providers, despite these facilities being previously accredited by the defunct NHIF.
This unlawful exclusion has resulted in over 1,000 clinical officers facility owned by clinical officers being denied entry into SHIF. The Social Health Authority management has declared that only facility registered by the Kenya Medical Practitioners and Dentists Council will be contracted under SHIF. This clear conflict of interest is a deliberate move to twist clinical officers into registering their facility with the KMPDC.
The union is criticizing the Ministry of Health for failing to honor the return-to-work formula that assured clinical officer interns of monthly stipends and medical cover. Officials say interns are yet to receive a stipend 6 months after the return-to-work formula was agreed upon, prompting them to walk out of their duty stations on the 26th of September.
They have not received their stipend or medical cover. Many are sleeping in hospital wards and relying on patient meals to survive. Over 3,000 clinical officers interns remain in limbo, waiting for placement amidst this chaos.
The clinical officers, who offer 70% of all clinical services in the country, have demanded inclusion in the panel of service providers and immediate disbursement of dues owed to clinical officer interns, failure to which they will take to the streets to compel the ministry to heed their demands.
The Social Health Authority must immediately empanel and publish the list of deserving clinical officers submitted by the Clinical Officers Council. The Social Health Authority must also empanel and publish all clinical officers on the facility registered under the Clinical Officers Council.
Mary Morki, Citizen TV.